we have with us online Dr. Rohitha Muthugala, consultant virologist, National Hospital in Kandy. A very good morning to you, Dr. Rohitha.
Very good morning.
Thank you very much for joining us. And we'd like to ask you, Doctor, in the current trend of the second wave of COVID-19 in Sri Lanka, well, it seems to be spreading in a bit of a different way than the first time around. Would you be able to give us your insight and your comments on this, Dr. Rohitha?
Okay, thank you for inviting me. Actually, this Corona-19 is a new virus. So most of our population is not immune or not exposed it to before. So when it comes into a non-immune population, people are not exposed before, it can spread very fast. So before October 1st week, we detect first case in Bandits. Most of positive cases came from abroad. They were confined into a quarantine camps or maybe like a very close clusters. But this case is coming from one particular cluster around individual people. So when it's come to like a society, like not in a society but in a close communities, it can spread very fast. That is the reason actually. When it introduced into the country and introduced into the normal population, it can spread very fast because we are not immune to that virus.
Right, and this time it has been spreading at a faster and at a bit of an alarming rate, isn't it?
Yes. Actually, they are also finding that this virus is a bit of a change with the time, that their transmissibility, that means it's one person to transmit to other person, the chance of transmissibility also little bit of an increase due to change in the virus also. And also, we were a bit relaxed during our last few months. So people are gathering, not wearing masks, that also contribute little bit to spreading among the people also.
Right, and this is not only a national issue, Doctor, it's also from a global viewpoint. So talking of this virus, what would you be able to think in like eliminating this virus? What are your thoughts on that in the total elimination of this virus?
Elimination will be difficult, but if we get a good vaccine, at least it provides 90% of protection, then we can eliminate this virus. But whatever the going on, I think we have to live with this viral infection for the next couple of years, actually.
So basically, it's here to stay for some time, is it?
Yes, definitely it will be staying.
All right, so Dr. Rohitha, would you be able to give us a take-home message as we have got to live in a new normal atmosphere with the virus also circulating? What would be your message to us?
Actually, we have to adapt to this new situation. The main thing is we have to practice our health activities. Wearing a mask, avoiding social gathering, keep social distancing, and hand hygiene. That is the main important thing. If you can practice these things very well, then you can avoid getting the infection from the others, also prevent giving infection to the others. We have to strictly practice these new health guidelines and new practices to combat with this current situation.
All right. So as you reiterate, the most important thing is a face mask, isn't it?
Face mask, social distancing, and hand hygiene.
Right. Thank you very much, Dr. Rohitha, for being part of the program and for giving us your valuable insight.
Thank you very much for inviting me.
You're most welcome.
Okay.
That was Dr. Rohitha Muthugala, consultant virologist, National Hospital in Kandy.